Hello, everybody. Welcome. Welcome to our first annual election 2025 webinar for the HealthFlex plan. My name is Kelly Whittick, and I am the Director of Health and Wellbeing here at Wespath Benefits and Investments. And I will be talking you through all things annual election today. So I thank you very much for joining us, whether you're joining us live or via recording. We are recording our session today, so if you aren't able to attend live or can't attend the whole thing, that you're welcome to listen to the recording after the fact. If you do have questions, there is a question and answer button, I believe, on the bottom, and you'll go ahead and click that, and then you can ask any questions. And then myself, as well as my colleague, Bob Gerlach, and Cheryl Hatcher, we are all here to answer the questions and make sure that you get what you want out of this webinar. So let's go ahead and get started. So today we're here talking about annual election for 2025. My goal is to give you some tips to help you make the best possible choice for yourself or your family going into the next year. And I am going to provide a little bit of review information about HealthFlex. So if you've been with us for a while, some of it will be review. If you're newer to HealthFlex, then this is probably all pretty new information to you. So let's first put these dates on our calendar. So annual election, so when we make our benefit elections for 2025 starts October 30th, which is next week, and it ends November 14th. So between now and October 30th, when annual election opens, you can get started and go ahead and start looking through some tools to make sure that you feel confident in your election for 2025. If you've used these tools in the past, that doesn't mean that you shouldn't try them again. I actually make sure that I go through Alex Benefits Counselor every single year, even though I know a lot about these plans, because it's nice. Alex does the math behind the scenes, and it's good to make sure that you feel confident in your plan selection. And we also have our OptumRx pricing tool, which is live, and that's a great way to estimate what your medications might cost under the different plans, particularly if you're looking at some of the health savings account plans. Once October 30th rolls around, we strongly encourage you to get in there and make your elections. You can make it right away on October 30th, and if you change your mind over the 2 weeks, you can always make a change. We just take whatever your election is at the end of the time period. But if you get in there early, you know that you haven't forgotten, and if something happens the last couple of days of annual election, you are confident that your elections are already made. So that's your opportunity to choose your plans, choose which dependents you want to cover, and choose what you want to contribute to health accounts. If you do not go in between October 30th and November 14th to make an election, you will be enrolled in the same plans you are for this year. So maybe you're thinking, that's good, that's all I want. However, you will have no personal FSA or HSA contributions. And that's really a big miss, because almost everybody has out-of-pocket expenses that they can benefit from having those be tax advantaged. So we strongly encourage you to go in, make sure that your elections are what you want them to be, and really consider making some contributions to your HSA and or FSA for the year. If you're new to HealthFlex this year and you haven't been enrolled with us in the past, you don't make your elections, you'll be defaulted to your plan sponsor's default plans. All right, here we go. We're going to dig in, do a little refresher on HealthFlex, and then I'll walk through the different plan options. So we'll look at medical, dental, and vision plans. We'll talk about premium credit. That's a term that you see during annual election. We want to make sure you know what it means. We'll definitely dig into the health accounts a bit. So this is our acronym soup, right? Alphabet soup. So we'll make sure we talk about the difference between those different accounts, remind you what decision support tools you have available, and then make sure that you know how to make your elections for 2025. Before we dig into that, I do want to level set and make sure that we're all speaking the same language. So we do have some terms and acronyms that we like to kick off our HealthFlex AE webinars with. So first, we have coinsurance and copayment. So these are words that speak to amounts that you as the member pay towards your service. So when you have a health benefits plan, it covers maybe a portion of the care that you receive, and then you might be responsible for a copayment, which is a fixed amount of money, or coinsurance, which is a percentage of the bill, depending on the plan design and depending on the benefit. So we do have some plans that offer copayments for various services, and then all of our plans have coinsurance for certain types of services. An explanation of benefits, or EOB, is a document that says, hey, this is a service that you got. Here's how much you were billed. Here's what the discount was, if any. And then here's how much your plan paid. And here's how much your responsibility is. So that's a benefit, or a document you can find on your care coordinator site. And so we encourage you to take a look at those each year, because it can help you estimate how much some of your services might cost if you have them again in the future. The word formulary is a list of medications that are covered by the plan. As much as we would love to be able to cover all medications everywhere, that would create a much higher cost of premium to be on the plan. So we work with OptumRx to create a formulary that says, okay, these are the medications that are covered. We do make sure with independent pharmacists and physicians on their pharmacy and therapeutics committee that there is some medication to treat any particular medical need. And so that list of medications is really tells you what is covered by HealthFlex, what medications. And that formulary is the same regardless of whichever plan you choose. Deductible, that comes with coinsurance. So this is an amount of money that you have to pay before your plan starts paying for various services. I think we're often most familiar with like our auto insurance deductible. So if you get in a car accident, you're responsible for the first certain amount. And then after that, your plan starts paying for portions. Same thing with a medical plan deductible. So you're responsible for the first certain amount. And then after you've met that deductible, then the plan coinsurance kicks in. Out-of-pocket maximum, that's the maximum amount that you would spend for covered services. And so that's medical, pharmacy, and behavioral health. And we'll talk a little bit more about how that works. Premium credit, I have several slides on premium credit, but this is the amount of money that you receive from your church or employer or plan sponsor to help pay for your plan. So every plan costs money to participate. The premium credit is how much you're given from your employer to help offset the cost of that plan. And then premium, that's the cost of that plan. So like I said, every plan costs a certain amount in order to even participate and be covered by the plan, and that's the premium. And with HealthFlex, we are very transparent about how much the premium is for each plan, because we want you to know, exactly what you're choosing between. So you should see that information available when you go through your elections. All right, we have a couple more terms on this page: HMO versus PPO. HMO stands for Health Maintenance Organization. It's typically the type of plan and network that means, okay, you have a primary care provider and you have to get permission from your primary care provider in order to see other individuals. In HealthFlex, the only HMO we have is a dental HMO, and so you would have a primary care dentist in that HMO plan. All of our other plans are called PPOs, which is Preferred Provider Organization. So there are some providers that are in network, and that means that they are contracted by the plan to give you a discount for services received. But it also means that you can go see whichever provider you want, in or out of the network, but the in-network providers are typically a better deal for you. And then we have our terms that signify our health and reimbursement accounts. So FSA is flexible spending account. We have two types: healthcare and dependent care. We'll talk a little bit more about those later. HRA is a health reimbursement account, and HSA is a health savings account. So we will talk about those different types of accounts later, but I wanted you to have kind of this for a resource to know what these terms mean when we start talking about them. Okay, here we go. Let's do HealthFlex in a nutshell. So one of the things that we work really hard to do at Wespath is to make sure that we're partnering with really the top providers of various types of services in the industry to make sure that our participants and members and their covered family members have the best access to care. So we partner with Quantum Health. They provide the Wespath Care Coordination Service. And we also partner with Blue Cross Blue Shield to provide a nationwide network of providers and practitioners that provide discounted rates to our members. We partner with OptumRx on pharmacy benefits. So that's OptumRx not only provides the formulary and the network of pharmacies, but they also help negotiate lower drug prices through rebates and other pricing guarantees. We partner with Vision Service Plan, VSP, for our vision benefit, and Cigna for our dental benefit. We partner with MD Live to offer virtual care, both virtual urgent medical care as well as virtual behavioral health services. And we partner with Health Equity to provide all of our health accounts, and those are the FSAs, HRAs, and HSAs that we talked about. We also really focus on having broad network and formulary access. And I want to underscore that all of the plans that we talk about today use the same broad nationwide PPO network through Blue Cross Blue Shield. It's called Blue PPO. And that's true whether whether you live in Alaska, whether you live in Florida, whether you live in Maine, whether you live in California, and anywhere in between. So the same Blue nationwide network, and then we use the same OptumRx premium formulary and retail pharmacy network for all of our plans. Now, HealthFlex has a couple of key points that we feel are important and provide the best possible service to our members. First of all, we offer you choice. So we offer you 6 different medical and pharmacy plans to choose from, up to 3 dental choices, and up to 3 vision choices. So you've got the ability to kind of right size and pick the plan or selection of plans that's really the best fit for you and your household. All right, so I said that we have multiple options available to us, and that's a really key tenet of HealthFlex, is to have multiple plan choices so that you can pick the plan that's the perfect fit for your family, based on their covered, like based on what various medical needs that they might have, as well as what your personal preference and risk tolerance is. And then we don't set you like totally out on your own to kind of decide and fend for yourself. And when you have all those choices, we make sure that we have tools that will really help you. And we'll talk about those today. There's Alex Benefits Counselor, as well as the Optum pricing tool for medications. So that, plus all the plan comparisons and detailed information that we have, should hopefully help you make the best decision for you. All right, so all of our plans, regardless of which one you choose, all of the medical plans include a very robust selection of well-being programs and incentives. That includes activity tracking through Virgin Pulse. In the future, Virgin Pulse will be called Personify Health. We have our Blueprint for Wellness screening, which is a blood draw. We have health coaching, diabetes prevention, emotional health support through the EAP, and HealthFlex offers you cash if you're a participant or a covered spouse, up to $410 in Pulse Cash for participating in various well-being initiatives. We also encourage you to complete your health check questionnaire. For those of you who have been with us for a long time, or at least since April, hopefully you completed your health check before August, and are avoiding the higher deductible in 2025. We also have care coordinators, and the Wespath care coordinators are really our way of helping make it easier to navigate the complex healthcare system. So these are nurses, they're experts in benefits, they're people who will call your provider and help you navigate the challenges of healthcare and prevent you from getting caught in the middle of various billing issues and problems. They can also help you find in-network providers, verify that you have coverage for a certain benefit, get prior authorization approvals, et cetera. So we think that this is a really great service, and these 2 things are included in all of your HealthFlex plans, regardless of which one you choose. So here's a quick highlight of our various well-being programs. I mentioned Blueprint for Wellness and Health Check. Those are great ways to just kind of assess your health status and kind of see where you're at and make some goals for the future. And then we have a very nice suite of various wellness programs that are there to help you either maintain or improve your well-being. That's Virgin Pulse, the health coaching, MD Live, the employee assistance program. We have chronic disease prevention and diabetes management through Omada, and we also have a partnership with Weight Watchers. So again, a robust suite of well-being programs, and you get this with every HealthFlex plan, every medical plan. I also wanted to share this QR code if you want to go ahead and scan this. This is a great tool to use to help you navigate the different mental health resources specifically. So the various emotional well-being programs, if you know, it can be hard to decide which one should I use. You have so many options available. Scan this QR code. It will kind of ask you some guided questions and help point you to the best possible mental health solution for you. And then just looking a little bit deeper into the care coordination, remember I said that the Wespath care coordinators are offered with every single plan. You can speak to a care coordinator to check your benefits before you get a service. If you have a problem while you're at the provider's office, you can get immediate answers. You can get help finding an in-network provider. You can get some help estimating how much a service might cost or understand why a service cost how much it did. And if you find that your provider is kind of going back and forth with Blue Cross Blue Shield or OptumRx, it's a great person to kind of step in and be like, you know what, why don't I take care of this? And the care coordinator can help you through that process. And then they can also do something as simple as order you a new ID card. So the care coordinator's number is on the back of your HealthFlex ID card. So on the front is your member number and Blue Cross Blue Shield. And on the back, it says the care coordinator's number. And you can really call them anytime from 8:30 to 10 Eastern time. And you can also send secure messages to them. And they are there to help guide you through the process. Also, if you didn't know, your provider also reaches out to a care coordinator when they're trying to confirm a benefit or get an authorization to verify your eligibility and coverage for certain services. If you do need pre-certification for a process or for a procedure, they are the ones that assist with the pre-certification. It's true that the local provider will submit claims with their local Blue Cross plan, but in the end, all of those claims come back to Illinois, which is where Wespath is located, and to the care coordinators. Okay, well, I'm knocking on wood and hopeful that my audio issues have improved. I'm sorry that I turned off my video, but I think that that's better than having to shut down again. But let's go to this next section, which looks at the different medical, dental, and vision plan options. So the good news is in 2025, we are not making any changes to which plans are being offered. I know last year we had some significant changes. So if you were with us then, you might be breathing a sigh of relief that we're not changing, we're not taking away any of the plans that you've already been enrolled with. So if you like the plan that you have, you can elect it again for next year. So we have 6 medical and behavioral health and pharmacy plans. The different leaf colors tell you what type of a plan it is. The green leaf is a health savings account plan, the blue leaf a health reimbursement account plan, and the orange leaf is a traditional PPO plan. The gold apples, those plans tend to cost more money in premium to be on the plan, but then they pay a little bit more when you go get services. The silver and bronze colored apples, you pay less to be on them each month, and then you pay a little bit more when you go to get services. We have 3 dental plans. Some folks won't see the dental HMO offering if you don't have any dental HMO providers in your area. But you have 2 or 3 options, the different PPO and passive PPO, as well as the dental HMO. We have 3 vision plans, which I'll go over, and then we have the different health accounts. So let's look at the medical plans first to start. The only change in plan design for the HealthFlex medical plans this year is, unfortunately, we are sunsetting the $0 member costs for MD Live. So we've said that is $0 all the way through 2024. We would love to continue offering it in 2025 at 0 cost, but unfortunately, the U.S. Congress has not extended the provision that would allow us to continue to offer it at $0 for all plans. We are advocating on your behalf and on our behalf to be able to continue to offer this. We love this benefit and we loved being able to offer it at no cost to you. We will continue to advocate to reinstate this in the future. So let's look at how much MD Live services might cost you if you choose to use them in 2025. Remember, you can still use MD Live through 2024 and pay $0 out of pocket. So feel free to test it out when it doesn't, when it's not going to cost you anything. So in 2025, your regular plan designs will apply for the different MD Live services. So for acute care visits, that's if you call because you've got a rash or you've got some kind of respiratory thing going on. Nothing life-threatening, of course. You should go to an ER for that. But if it's something that you either can't get an appointment with your doctor or you can't wait to see your doctor, it's a great service to get a physician's opinion and insight and potentially a prescription medication in a short period of time. So the H plans and the C plans, so that's my first 5 plans, those all have this benefit is subject to the deductible. So you have to meet the deductible first, and then the plan pays the coinsurance. So these acute care visits are $51 in 2025. So until you've met your deductible in those 5 plans, you'll pay $51 for an acute care visit. Still a very good deal for a medical visit. Most primary care doctors' visits are probably in the $80 to $100 range. So not only is this something that you might be able to get right away when you can't get access to another provider, it's also a low-cost option. Once you've met your deductible, then you pay your portion. So for the H2000 and C2000, your portion is 20%. That's $10.20. For the H5000, you've already, your deductible is your out-of-pocket maximum. So after you meet your deductible, you pay $0. The one plan that has a copayment for MD Live is the B1000, and that's $15 for every visit. Behavioral health applies fairly similarly. The exception is in our C plans, those are the HRA plans, you do not need to meet the deductible before the plan pays its coinsurance. So in our H plans, let's say you wanted a 45-minute psychotherapy visit with a master's level counselor or a psychologist, that would normally be a $92 charge. So if you haven't met your deductible in the H plans, you'll pay the $92. Once you've met your deductible, you would pay $18.40 in the H2000, $27.60 in the H2500, and then $0 in the H5000 because you've already met your out-of-pocket maximum. All right, so in our C plans, again, you don't have to meet the deductible first, so you just pay your coinsurance. So it's 20% for the C2000, 50% for the C3000. And then in the B1000, I think I mentioned before, it's always a $15 copayment. All right, so that is the one change. Everything else is the design is exactly how it was in 2024, but we wanted to make sure that we call this out. So remember we talked about deductible and coinsurance. So this is all of our plans function this way for big services, like if you go to the hospital or if you need outpatient care in a hospital setting. So you meet your deductible first, and then the plan pays its portion of coinsurance until you hit that out-of-pocket maximum. Once you hit that out-of-pocket maximum, you don't pay anything else as long as it's a covered service for medical, pharmacy, and behavioral health. Now, during that deductible coinsurance phase, you can actually use your health accounts, your FSAs, your HSAs, your HRAs to help pay for your share of the plan. Once you hit that out-of-pocket max, though, you don't need to pay anything else as long as it's a covered service. And all of our plans have the same out-of-pocket maximum. So $5,000 for an individual out-of-pocket maximum, and then $10,000 for everybody in the family. Very few people actually meet their out-of-pocket maximums, especially the family one, but it is comforting to know that it's there. Now, copayments, which we'll talk a little bit about, they can be due at any time during the deductible or coinsurance phase, but not once the out-of-pocket maximum has been reached. So once you've hit your out-of-pocket maximum, you won't owe any copayments for services either. However, copays don't count toward the deductible. They only count toward the out-of-pocket maximum. And non-covered expenses, so like cosmetic surgery or a service that's not covered, experimental procedures, they do not count to the deductible or out-of-pocket max, and neither do dental and vision expenses. Now, here are some ways that all plans are similar. And I think that this is important because we don't want folks to kind of be scared away from selecting certain types of plans, thinking that they won't have access to certain benefits. So every single one of our plans, they have that PPO network, so you can see the provider or the doctor of your choice. You don't need a referral. Every single one of these plans uses the same Blue Cross Blue Shield PPO network. We've talked about that. They all use the same formulary. They all have the care coordinators. They all cover the same services and medications. So there's no service that's covered in a B1000 that's not covered in the HSA plans. The difference is how much the plan pays for those services. And then they all have these comprehensive well-being programs and incentives. So these are ways that all the plans are similar. Now, here is how the plans are different, and we've blocked them into categories of plans. So we have our HSA plans; those are the ones that start with H. Our HRA plans start with C, and then the B1000 is a standard PPO plan. So when you're going to the doctor, when you're going to urgent care, when you're going to the ER, only the B1000 plan has a fixed copayment for those services, a fixed known price. All of the other plans, the H and the C plans, you have to meet your deductible first, and then the plan pays coinsurance for these services. And that doesn't mean that the plans are worse. It just means you sort of have to plan ahead to have some out-of-pocket expenses. And so that can be a place where people get caught up, is because they enjoyed the low premium of the cheaper plan, but they forgot to plan to pay a little bit more when they go get services. For medications, only the HSA plans do you have to meet the deductible first before the plan coinsurance kicks in. So in the HSA plan, that deductible applies to everything, including medications. In the HRA plans and the B1000, you just go right to your coinsurance and copayment for the medications. Behavioral health visits, and also this is true for MD Live behavioral health. And again, this is in 2025. Remember, the $0 MD Live option ends at the end of this calendar year. But for HSA plans, similar to other types of services, you have to meet the deductible first, and then is when the plan starts kicking in to pay its coinsurance. For the HRA plans, you don't have to meet the deductible. You just pay the coinsurance, and then the B1000 has those fixed copayments, like the $15 we saw for MD Live. And then depending on which plan you elect, you might be able to have different access to different health accounts. So only the HSA plans, which are qualified high deductible plans, have access to a health savings account. And those are the triple tax advantaged accounts. You can also use a limited use health flexible spending account with an HSA plan. Our HRA plans, those C plans, you can use a health reimbursement account that comes with it, or a flexible spending account. And our B1000, you can only use the flexible spending account unless you have leftover money from an HRA or HSA. All right, I want to point you in the direction of this plan comparison. This is really our key piece that lays out the plan designs at a high level for all 6 different plans, as well as the dental and vision plans. And so I'll refer to it multiple times during this presentation. All right, so when you're comparing plans, I want to underscore that having a higher premium doesn't mean the plan is better. Remember, the same quality of care, the same types of services, the same medications are covered on every single plan. And truthfully, when we look at it, over 90% of the people in HealthFlex and the households in HealthFlex would actually save the most money in an HSA plan. And that is why you should not be surprised if when you go through Alex tells you you will be better off in an HSA plan. Because if we look purely at the financials, over 90% are going to be best off in an HSA plan. That doesn't mean it's the best plan for everybody, because there are more things to think about than just money. It could also be your comfort, your preparation for unexpected expenses. But if you want to save money in 2025 on health insurance, we want to make sure you're looking at the big picture, how much you're spending in premium, plus how much you get in the health account included in the plan, plus what you pay out of pocket for services. Far too often, people only think about how much they're paying for services, and then they end up paying a lot more to be on the plan, not get any included health account contribution, and then they end up spending more money in the long run. So that's just something we encourage you to look at, and Alex will help you look at that. We do encourage you to take a look at what you've gotten done in the past. If you see a cardiologist every year, you have an explanation of benefits that will help you estimate how much you're going to be charged for a cardiology visit. In my example, I know that my daughter sees a cardiologist, and every year that's going to cost us, with all the testing and the echoes and EKGs and Holter monitors, et cetera, that go with it. Every year that's going to cost us like $3,000. So I just plan for that. I'm in one of the HSA plans. I know that's what it's going to cost because I have the explanation of benefits from the past year. I can also call my care coordinator, and ask them, what type of if I think I'm going to get this done next year, if I'm going to have this, like, is there one plan that might be a better fit for me? So they'll help you understand how the different plans work with services you might expect to receive. We do encourage you to use Alex and the OptumRx pricing tool to really estimate your future expenses and to determine how much to set aside in a health account. Finally, if you choose a lower cost plan, we strongly encourage you to take what you're saving in premium by choosing a lower cost plan and put that money into an HSA or an FSA. Far too often we see people choose the lowest cost plan just because it's cheaper and not really come up with a plan for paying the out-of-pocket expenses that come with it. Here's the data that I wanted to share from before. I said about 90% of the population is best off in an HSA plan. So that's, if you look at the top one, we looked at everybody's anonymous claims in 2023, and we said, okay, which plan would be the cheapest plan for them given that constellation of claims? And you can see it's about 90% of the population is best in the yellow, green, or blue plans, which are 3 HSA plans. Less than 1% of the population is best off in a B1000 or a C2000, which are the most expensive plans. However, you can see, we see a lot more people enroll in those plans. Money is not the only option, or not the only consideration. So if you feel more comfortable paying more upfront, and knowing that you won't have to pay as much if you need services, then that is certainly your choice as well. So when you're deciding if a health savings account plan is right for you, we definitely encourage you to look at the full picture, right? The net cost, the premium that you pay, plus the HSA contribution, plus any out-of-pocket costs. It's often lower, but then have a plan for how you're going to manage your cash flow when you have to pay for services, particularly at the beginning of the year. Remember that out-of-network claims, especially if you are getting out-of-network behavioral health or therapy claims, you pay those up front and then you request reimbursement. So you'll have to float yourself a little bit of funding until you get reimbursed for those. We encourage you to use your HSA and maybe even setting up a payment plan with providers so it gives you time to kind of catch up with your HSA contributions. If you're in an HSA plan this year, see if you have any extra money to be able to make an extra contribution to your HSA before the end of the year. Obviously, that only works if you haven't already hit the maximum, but that way you'll set yourself up to have more funds at the beginning of next year. I always try to elect $1,000 more than I'm going to, or than I think I'm going to need, in hopes that I will be able to roll it over to the next year. And then finally, consider low or no cost options for care. So in 2024, that might mean MD Live. In 2025, that might mean choosing MD Live instead of an emergency room for a non-emergent but immediate need. It might mean using the EAP and their no cost visits, so look for options to choose lower cost services. Wespath also sets some things up with the HSA plan to really try to help make medications as affordable as possible. So one thing that we've done is we've installed this preventive drug list with OptumRx, and that means if your medication is considered preventive, and please note that the list is generated by OptumRx, Wespath does not determine whether your medication is preventive or not. But there are several preventive medications like for diabetes and cholesterol and antidepressants, et cetera. If your medication is considered preventive, you do not have to meet the deductible first. The plan will just start kicking in its share of coinsurance. So another great reason to use the pricing tool, because you're like, okay, is my medication preventive? The pricing tool includes formulary and preventive drug list. And then it also helps you price how much your drug will cost under the different plans. And then we also work with OptumRx, who negotiates rebates for medications. And though rebates are not my favorite thing because they're not very transparent, we are able to work with OptumRx to get aggressive rebates that allow us to lower the overall prices of drugs. And then we pass that on to you all as the participants. So where some plans would just kind of keep that money and use it to offset premiums, we actually apply it when you purchase your drug, so you get the benefit of the rebate, especially if you're in an HSA plan. That's important, so you don't pay a bigger amount and then somebody else gets the rebate on the back end. So you get to take advantage of the rebate. All right. Also, when we're looking at HSA plans, particularly the H2000 and the H2500, I want to share a little bit about how the deductibles work differently. I think it's important to understand how the deductibles work. So I have these two plans. The C2000 is an HRA plan and the H2000 is an HSA plan. Both of them have a $2,000 deductible. So that means if you only have one person covered, you pay the $2,000 and then the plan starts paying 80% and you pay 20%. However, if you're covering more than one person in these plans, and only one person has expenses, in the HSA plans, the H2000 and the H2500, the family deductible always applies. So that means even if only one person has expenses, your deductible is $4,000 in the H2000. Your deductible is $5,000 in the H2500, and then the plan pays its portion. But for the C2000, the C3000, and the B1000, you actually only have to meet still the single deductible. Now, for the H5000, that's a little bit different, and that's because the deductible equals the out-of-pocket maximum. So you don't have to meet that family deductible, because once you've met the single deductible, you've also met the single out-of-pocket maximum. And again, that plan comparison document that I shared earlier, and I'll share again, can really illustrate the different deductible and out-of-pocket maximum amounts. So if two or more people have expenses, it's still the family deductible that applies on the HSA plan. And then in the case of the HRA plan, you also have the family deductible if you have two or more people with expenses. Remember, the out-of-pocket maximum always applies. So even if you have the family deductible and only one person with expenses, that one person's expenses are still capped at $5,000. You can use your HSA to help offset that higher deductible. And then honestly, most families have several people that are contributing toward the deductible. So it's unlikely that you would cover several people and then only have one person with expenses. But we did want to make sure that we illustrate that difference. Okay, I'm going to do some comparisons on how a couple of different types of services would pay under the different plans. In this case, I'm going to look at a couple of medication examples, and then I'm going to look at a behavioral health example. So I hope that these illustrations are helpful to you in understanding the different plans and how they work. So this example is a generic medication, and it's not considered preventive. The medication, the full price of a 30-day supply of the medication is $110. The full price of a 90-day supply is $330. This includes the discount applied by OptumRx. So in the B1000, C2000, and C3000, since this is a generic medication, you will just pay a copayment. You'll pay $10 for a 30-day supply. You'll pay $25 for a 90-day supply. Remember, if it's a maintenance medication, you do need to get it to a 90-day supply, and you do need to do it at a Walgreens or OptumRx. In the H plans, you're going to pay the full discounted cost of the medication. So you're going to pay the full $110 for the 30-day. You're going to pay the full $330 for a 90-day. This might feel like a lot, but this does count towards your deductible, and so it decreases how much else you have to contribute in order to reach that deductible. In the H2000 and the H2500, once you reach that deductible, you can just pay the co-payments, the same co-payments as the other plans. In the H5000, once you reach your deductible, you've also met your out-of-pocket maximum. So then you're done. You're done paying for covered services. Now, what if this medication was preventive? So same medication cost, same thing in your B1000, C2000, and C3000, but now because it's preventive, you're also going to only pay the copayment in the HSA plans. So that's a big advantage if you're taking medications that are on the preventive drug list and may make an HSA plan a little bit easier for you to handle. All right, let's look at a brand medication. This is a non-preventive brand. They typically tend to be more costly, but there are some lower cost brand medications as well. So let's say in this case, a 30-day supply is $267 and a 90-day supply is $726. In the B1000, C2000, and C3000 plans, you pay a percentage up to a certain maximum. And so these medications are costly enough that they hit that maximum. So you'd pay a maximum of $65 for a 30-day supply, a maximum of $165 for a 90-day supply, and that's your co-insurance. In your HSA plans, again, you need to meet the deductible first. So until you meet the deductible, you're going to pay the full discounted cost. And this can be costly, right? $700 every 90 days. It's definitely something you have to plan for. But after 4 months of, after 4 cycles of 90 days and the full year, you've now spent $2,900, which might be your deductible if you're in single coverage in the H2000 or H2500, or it could be significant progress towards your deductible in the H5000. If that same medication was preventive on the preventive list, same thing, you would just pay the maximum coinsurance for all plans. So again, this is for a lot of medications that are used to treat ongoing conditions and prevent worsening. Prevent worsening of ongoing situations like antidepressants, like cholesterol medications, like blood pressure medications. All right. So the Optum Rx drug pricing tool is available now. You can use that to determine whether you're on the preventive list or if additional authorization is needed and how much it's going to cost under different types of plans. So we definitely encourage you to take a look at this. Now let's look at an outpatient behavioral health comparison. So a special benefit that we offer in HealthFlex is that we cover out-of-network outpatient behavioral health counseling sessions at the same design level, the same plan benefit level as in-network. So whether your provider is in or out of network, we will give you the same benefit of deductible and coinsurance, or the same coinsurance, or the same copayment, depending on your plan. So let's say that you're going to an in-network Blue Cross Blue Shield PPO provider. They might bill $140 per session, but Blue Cross discounts it to $80. In the HSA plans, you're going to pay that full $80 until you've met the deductible, and then the plan is going to kick in for the coinsurance. In the C plans, you're just going to pay the coinsurance. So in the C2000, that would be 20% or $16. And then for the B1000, you're always just going to pay the $15 copayment. If your behavioral health provider is out of network, we will still cover the full cost, or we will still cover the visit, even though this provider is billing $140 instead of $80. The same design applies. So the plan will pay, for the HSA plans, the plan will pay after you've met your deductible. So you pay the $140 until you've met your deductible. And then depending on which plan you're in, you pay the coinsurance after that. In the C plans, you just pay the coinsurance, and in the B1000, it's always $15. I do want to emphasize that for out-of-network visits, the provider probably won't submit the claim to Blue Cross Blue Shield, which means that you may have to pay the provider upfront and request reimbursement from the plan. Okay, well, that is a good selection of questions on, or of information on medical. I know that Bob has been diligently asking questions or answering questions in the Q&A. Bob, do you want to share any questions on the medical plans that I should read out loud? And it's okay if not.
I don't think so, Kelly. I think
Okay.
I've just got a couple that I'm behind on trying to
Okay.
answer right now, but I think I'm all caught up. Anyone, give me like 2 minutes if you haven't seen an answer to your question. I'm working on a couple right now, and then I think I'm all caught up. So
Okay.
if you if I didn't fully answer your question, please feel free to send another question in, and I'll do better.
Okay, thanks so much for answering those questions. A lot of very personal questions that we wouldn't necessarily want to read out loud, but we're glad they're getting the opportunity to ask them. All right, let's look at dental plans then. So we have those 3 dental plan options, up to 3. If you don't see the dental HMO, it just means you don't have access to an HMO provider. These are the names of the Cigna networks that we use for the different plans. So the passive PPO and the PPO dental plans use the Cigna PPO Advantage network. This is different than the Cigna Total PPO network. It's actually a little bit narrower. And so just be careful when you're looking for a dentist that you are choosing a dentist in the Cigna PPO Advantage network. The DHMO, the dental HMO, uses the Cigna Dental Care Access Plus network. That's an HMO network, and it is a narrower network. Sticking with the DHMO, the nice thing about DHMOs is that they don't have deductibles. They have co-payments that really follow a specific schedule. They include adult orthodontics, but there are 0 out-of-network benefits. You have to go to your primary care dentist first. In the PPO plans, the passive PPO has a more generous out-of-network benefit. So if you can't find a dentist you like in the PPO Advantage network, we encourage you to choose the passive PPO. If your dentist is in the PPO Advantage network, then the PPO is a better deal because it has better benefits for a lower cost if your dentist is in network. For ID cards, we don't mail the Cigna PPO dental ID cards, but you can go online to Cigna through Benefits Access and print your own, or your provider can look you up. And then the dental HMO plan, if you do choose that, every family member who enrolls will get a separate ID card that has their name and their primary care dentist. You don't have to choose a primary care dentist if you are in one of the PPO options, but you do have to choose one if you choose the DHMO. Otherwise, they will assign one to you. So here is some details about what you want to look for to see if your dentist is in network. These are variety of different dental networks through Cigna. You want to look at Cigna Dental Care Access Plus for the DHMO and Cigna DPPO Advantage, not total PPO, so DPPO Advantage for the PPO plans. So make sure that you know if your dentist is in network so you don't get accidentally charged out of network rates in a passive or in the PPO, or have your services not covered in the DHMO. So pointing back to the same plan comparison, this is the same one we looked at before. If you flip a little further back, you see information about the dental plans in more detail. Okay, let's go on to vision. We have 3 vision plans. The exam core is a no-cost plan. If you enroll in medical, we can enroll you in exam core for $0. The full service and the premier plans are buy-up plans that include access to glasses and contacts. So all of the plans cover an eye exam each year for a $20 copay. There is an additional cost for retinal photos or diabetes eye care. The plan uses the VSP provider network. It's a pretty broad network. It includes some chain stores like Costco and VisionWorks. It also includes a lot of private practice providers. The exam core plan does not have any out-of-network benefits. If you're going to use it, you have to get an exam done at an in-network provider. If you have one of the buy-up plans, you can go out of network, but the benefits are significantly reduced. So if you're going to, if you're not going to see an in-network provider, it might be best to just waive vision insurance. ExamCore doesn't cover glasses and contacts, but it does sometimes give you a discount depending on the provider. The full service plan, you get $160 either towards glasses or contacts for each covered individual. The Premier plan gives you $200 toward either glasses and contacts or 2 pairs of glasses. The full service plan covers progressive lenses. The Premier plan covers progressive lenses, UV protection, and then a small copay for anti-reflective coating. You don't get an ID card for vision, but you can go to vsp.com and print out your benefits. But as long as you're going to a VSP provider, it's been my experience that they're able to look you up quite easily. So in the same plan comparison document, we do have some information about the vision plans. All right, well, let's move on to premium credit. That is kind of a term that Wespath coined to describe how your employer or annual conference, your church, or other organization helps you pay for health premiums. So the premiums are different depending on which plan you choose to enroll in. And the premium credit is determined by your plan sponsor. So they decide how much premium credit you get. It can vary by how many people are enrolled. So some plan sponsors choose to give more money in premium credit if you cover more than one person. Others do not. It's really up to the plan sponsor. It can also vary depending on your employment status. So clergy might have a different premium credit than retired clergy, or lay employees might have a different premium credit than clergy. You cannot use premium credit to offset your personal health account contributions, but it can offset medical premiums, dental premiums, and vision premiums. If you choose plans that cost more than your premium credit, which most of us do, then you are responsible for the difference. So, and you would see that in Alex, you would see that online when you're making your elections, what your share of the premium would be that exceeds the premium credit. Now, there are a handful of people in some plan sponsor groups that have leftover premium credit. If this is you and you choose plans that cost less than your premium credit, we will automatically deposit the difference, like any leftover premium credit, into an HRA or an HSA, depending on which plan you choose, on a monthly basis. So you don't lose that extra premium credit. So let's do a couple of examples of premium credits and how they work. So in this example, somebody gets $800 a month for single coverage. They're choosing a plan, the C2000, that costs $1,000 a month. They're choosing a dental PPO plan that costs $40 a month. They're including choosing the basic exam vision plan, so no dollars in premium. And then they're going to contribute $100 a month to a health flexible spending account. So the premium credit is $800. The total cost of the premiums is $1,040. That's your 1,000 plus 40 plus 0. And so the participant every month will pay $240. That's the amount of their premium that exceeds the credit, plus $100, which is how much they're contributing to the FSA. So $340 each month will come out of this pastor's pay. Let's give another example of somebody with leftover premium credit. So in this example, it's 2 people covered and they get $1,650 in premium credit. They choose a low cost plan for only $1,500. They waive dental, so no dollars towards dental. They waive vision, or I'm sorry, they choose the ExamCore vision. And then they are going to choose to contribute $300 a month to an HSA. So here's their premium credit. They get the $1,650 every month. The total premiums of all the plans they've chosen is $1,500 a month. So there's $150 left over each month. That portion is deposited into an HSA each month. The participant doesn't have any extra premium to pay, but they do agree to pay the $300 a month in the HSA. So they'll have $300 a month withheld from their pay. When you add that to the excess premium credit, they'll have $450 a month deposited into their HSA. I hope those are helpful examples. All right, let's transition a little bit to health accounts, the different types of health accounts. Most of the plans, so 4 out of 6 of the plans, include money in a health account just by enrolling in the plan. So you have access to this money in January at the beginning of the year. And this is money that you get depending on which plan you enroll and how many people are enrolled in the plan. So for the HSA plans, our 2 highest cost plans, the H2000 and H2500, those come with money. And then the HRA plans, the C2000 and the C3000, those come with money. The HSA plans come in an HSA, the HRA plans come in an HRA. The H5000 is our lowest cost plan. The B1000 is our highest cost plan. Neither one of those plans include money in a health account. You can make personal contributions to your health savings account, and in fact, we strongly encourage it. You can also make personal contributions to a healthcare flexible spending account. Each of those have their own IRS limits for maximum contributions. A health savings account is triple tax advantaged. So if you find that it's a good fit for you, there can be a real significant financial advantage to contributing to an HSA. You can use the HSA in current year to pay your medical expenses with pre-tax money. That's similar to an FSA. You can also accumulate funds, so you can roll over funds indefinitely in your HSA. And you do not pay taxes on the interest. And as long as you use it for a medical expense, you also don't pay taxes when you spend it. So if you save the HSA and use it for future medical expenses, then you end up not paying tax on it, including on the earnings, which is why it's triple tax advantaged and really the most advantageous way to save money tax-free. If you choose a plan that has money that comes with it, so that was the H2500 and the H2000, you get that in January and it's available to pay claims in January. And I think we shared earlier, when we actually looked at participant claims, 90% of folks, our households in HealthFlex would actually save money in an HSA plan. So it's definitely worth considering. We do note a few things that some participants aren't eligible to contribute to an HSA. This includes people who are enrolled in Medicare, even if it's only Medicare Part A, even if you're only taking Social Security, you cannot contribute to an HSA, in which case an HSA plan might not be a good fit for you. These are our 3 different types of health accounts. I wanted to share what the annual limits are for 2025. We don't have the final limits for FSAs yet, or I think maybe we just got them today. So we will update those before annual enrollment and make sure that you have the most current information. You can use your HSA for any dependent that you claim on your tax return. Your HRA has to be used for people who are actually covered in HealthFlex. And your FSA you can use for tax dependents who are under 27 at the end of the tax year. So HSAs and FSAs you can use a little bit more broadly. HRAs you have to use for folks covered in HealthFlex. No limit on how much money you can roll over in your HSA and HRA. The FSA limit in 2024 was 640. That may go up in 2025. The HSA has ultimate portability. Even if you leave HealthFlex, leave the United Methodist Church, leave your employer, you still get to keep your HSA. If you terminate or waive HealthFlex and you have an HRA, you have 90 days to spend it down. But if you retire from the UMC or your health plan sponsor, then you can keep your HRA into retirement. FSAs you cannot keep beyond when you terminate HealthFlex. And only the HSAs actually offer either interest or dividends on your investment earnings. If you are choosing an HSA plan for the first time, you want to make sure that you accept the terms and conditions of the plan that allows you to Wespath to open a plan, an HSA in your name. It's possible that Health Equity will ask for some ID confirmation. They do that for a small portion of our population. The HRA wanted to just point out that if you have if you're carrying a balance of less than $100 and not adding to that, then we will send you a letter that says, hey, you have 90 days to spend this, or it will be forfeited. And that's just in the spirit of good stewardship, so that we're not paying more fees than you have in that HRA balance. For FSAs, if you're contributing to a health savings account, there are some restrictions around what you can use that for. If you do contribute to an FSA, though, you can use your funds at the beginning of the year, even if you haven't contributed the full amount. So which accounts you can have depends on which plan you choose. The HRA comes with the C plans. If you are approaching Medicare eligibility or already enrolled in Medicare Part A or receiving Social Security, or if you only have prescription costs or you only have behavioral health costs, and you don't have a lot of medical costs, it's possible that the combined deductible will not be in your best interest, and you'd be better off in a C plan with an HRA for certain scenarios. And we encourage you to look at Alex to figure out what those scenarios are, or what your scenario is. But if you are enrolled in family coverage, you can contribute more if you choose an HSA. If you know that you're going to hit, have a combo of medical and pharmacy expenses and multiple member of the family, then that family deductible isn't quite as stressful. And the HSA really does allow you to save for future expenses. So there's a pretty great advantage there, not to mention the triple tax advantage. So we definitely encourage you to take a look at those. We do have some documents. These are available on Benefits Access. If you are approaching Medicare eligibility or already enrolled in Medicare, we encourage you to take a look at this because, again, you can't contribute to an HSA if you're enrolled in Medicare, even if it's just Medicare Part A. And then we also have a document that talks about what are the unique situations in which you'd want both an FSA and an HSA. My typical suggestion is, if you aren't going to completely max out your HSA and contribute to the maximum, then you probably don't need to elect an FSA. But there are certainly some benefits to an FSA for dental and vision expenses. Health Equity that handles all these health accounts, they recently released a new white chip card. Happily, this card, once you receive it, it will work for all of your HealthFlex Health Equity accounts related to health. Not your dependent care FSA, but your healthcare FSA, your HRA, and your HSA, or whatever combination of accounts you have. So if you only have an HSA, you can use this card. If you have an FSA and an FSA and an HRA, you can use this one card and it will always pull from the FSA first. If you have an HSA and an FSA, then the card will know if it's a medical or pharmacy expense and it will pull from your HSA. And then at the beginning of the year, it will pull from your FSA for dental and vision expenses. Once you meet the minimum IRS deductible for HSA plans, you can have your FSA converted and use your FSA for medical, pharmacy, and behavioral health expenses. Totally understand that's a bit complicated. Part of the reason why we really strongly encourage folks to maximize their HSA before they contribute to an FSA. And that's a lot of letters. I do want to point out the dependent care flexible spending account. This is not for healthcare for dependents. It's actually dependent daycare. So this is for children under 13 or adult dependents. You can contribute up to $5,000. This is not connected to the white card, and you cannot submit claims in advance of contributing the money. So back to this plan comparison, we do have information about the different health accounts in detail in that plan comparison document. All right, well, I have given you a ton of information to think about the different plans. Now let's talk about how are you going to decide. Hopefully you understand a little bit better the differences between the different plans, and now you are ready to think about how you're going to make your decision. Our number one suggestion is that you use Alex Benefits Counselor. This is like a gamified tool that walks you through what care you think you'll need in 2025, and it includes information about how much your plans cost, how much premium credit you receive, and how much money you can get in health accounts for the different plans. And then it helps you estimate how much you'll spend out of pocket under each scenario. It's about 30 minutes to complete. When you think about how much money we all spend on benefits each year, it's 30 minutes well worth your time. Alex is programmed to know your premium credit. You just have to know your employment category, whether you're active clergy, retired clergy, a lay employee, on a leave, or a spouse of a deceased employee. You just have to know that, and then Alex knows what your credit is. So once you enter all your information, Alex will crunch the numbers and tell you, compare side by side the best plans. The blue is how much you pay to be on the plan. The green is how much Alex thinks you're going to spend in service, like getting doctor visits, medications, etc. And the red is the worst case scenario. So you might see a different recommendation depending on whether you think, whether you consider the worst case scenario or not. Alex also helps you decide how much to contribute to a health account by helping you estimate your out-of-pocket expenses. So the way that this works from a tax savings perspective, if you make $40,000 and pay 20% in income tax, and you contribute $2,000 to a health account, then you're only paying that 20% tax on 38,000 instead of 40,000. So you save $400 in taxes for each $2,000 that you contribute in this scenario. So that's why it's worth taking a look at it. And hopefully you'll go in and make a health account election, even if you decide not to take not to change your plans. Don't forget to use the OptumRx drug pricing tool. This is particularly helpful if you're looking at HSA plans, because you can get estimates on how much it's going to cost and have a sense of how much you need to set aside in your health account. So Alex, it gives you average drug prices, but actual drug prices vary wildly. So this can be a great way to assess how much you might pay out of pocket for medications. So some people have said, hey, I don't want to do these higher deductible plans. Like, what's the point? Why would I pay to be on a plan that doesn't pay for anything? Remember, even before you meet the deductible, there are a lot of benefits to being enrolled in a plan. You get 100% coverage for well visits, for age-appropriate medical screenings. Currently, you can still get, through the rest of 2024, $0 virtual visits through MD Live, also zero cost visits through the EAP. Blue Cross and OptumRx do apply discounts to the services and medications. So even though even though you are paying the full discounted cost, you are still benefiting from the discount. We apply rebates, pharmacy rebates at point of sale, so that further lowers costs. And if you are taking preventive medications, you don't have to meet the deductible first. So lots of things that are in your favor when it comes to the HSA plans. All of the information, including Alex, including the OptumRx pricing tool, you can find at benefitsaccess.org. So start there, log in. There will be a link at the top of the page that says annual election is coming. You click on that and it opens up a whole page with more details and information. Benefits Access is only available to primary participants. So primary participants, make sure to share the information with your spouse. If you are a covered spouse or have trouble accessing Benefits Access, you can use this more general page for other information, publicly available information about HealthFlex annual election coming up. And we will share these slides after the fact. So if you missed some of the QR codes, we will definitely get you access to the slides. When it comes time to making your elections on October 30th, because you're not going to wait until the last minute, you log into Benefits Access. If you want to use the tools again, you can do that. But you'll go in and you'll select your 2025 benefits. You'll click Get Started and you'll move on to the portal that gives you all the information and everything you need to actually elect your benefits. Make sure that you don't stop at Alex. Like if you go through Alex and Alex makes recommendations, great, write them down, and then go to Benefits Access and get started making your actual elections. In the annual enrollment system, you'll see that your premium credit is automatically applied. So in this example, there was the premium and then the credit applied, and this individual happened to have some leftover credit. It does appear as a credit toward the cost of plans. Remember, we said that it can be used for medical, pharmacy, dental, and vision expenses, but not for personal account contributions. Your premium credit is assigned based on who you cover in medical. If you do cover different people in medical, dental, and vision, you only get the premium credit for whoever is enrolled in medical. Please, oh please, oh please, do not decline the premium credit. We do look and try to find anybody who declines it. It does create some accounting challenges for your plan sponsor. We'll try to find you, but it's easiest if you do not waive that because you definitely want it. So to recap, between now and October 30th, please use Alex, use the OptumRx pricing tool, look at the information, pick your plans, talk to your care coordinator, get ready, and on October 30th, you'll go into Benefits Access and you'll actually choose your plans, choose your health account contributions. If it's your first time enrolling in an HSA, make sure you accept the terms and conditions. And if you are enrolling in a dental HMO, make sure that you are selecting a primary care dentist. If you do not go in during AE, you will either get your same plans as 2024 with no personal contributions and health accounts, or your plan sponsor defaults if you are newly eligible. You can make your elections by phone. We have our AE support center that will be open same dates, October 30th through November 14th. They can make your elections by phone for you. They can answer questions about the plan premiums and premium credits and help you select your plans. Your Wespath care coordinator can also help. They can help you understand your claims from 2024 and medications from 2024 and give you an idea about how the care that you receive might play out in different plan designs. So that can be a really valuable conversation to have with a care coordinator. And as we wrap up, I just want to share a few additional tips, in particular to avoid these common problems that people have. The first is that they don't use Alex or the pricing tool. They're just guessing. They're just assuming either they choose the cheapest plan and don't pay attention to how much they're going to need to set aside, or they choose the most expensive plan and don't realize how much they're spending on services they may not use. It's also a common mistake to go through Alex and then stop. So you don't think that just going through Alex means you've made your election. You have to go back to benefitsaccess.org and go through the actual election process. Be careful if you're clergy not to write different amounts on your charge conference form than you enter during AE. Maybe print off your benefit summary at the end of AE and share that with your charge conference. If you do elect a dental HMO plan, please make sure that you have a dentist that's in network, in the Dental Care Access Plus network. For the PPO plan, again, make sure that you have a dentist in the PPO Advantage network, not the total PPO network. Otherwise, it will be treated as out of network. If you are new to the HSA, make sure you approve the terms and conditions. And don't make the mistake of thinking a dependent care flexible spending account is for medical care for your dependents. It's actually for daycare. So just don't accidentally elect that if you don't have a kid who's under 13 or an adult dependent. All right, so today Alex is ready. The pricing tool is ready. Thank you for taking the time to attend this webinar. We've got an upcoming webinar next week on pharmacy in particular, and there will be a Q&A for that. We also have a deeper dive into dental plans. There will be a Q&A for that. Come October 30th, you can make your enrollments or your elections for 2025. Please don't forget. In December, you will late in December, if you elect a new plan, like new to you, or if you're newly enrolling in HealthFlex, you will have an ID medical card mailed to you in December, as well as the DHMO ID card if you elect that, or the white health equity card if you elect an account for the first time. And then, believe it or not, it will be January and you'll be using your 2025 benefits and your well-being programs, and you'll be contacting your care coordinator for any support you need along the way. The team here at Wespath has worked really hard to create a plan that really serves folks during their times of need. We know that health benefits are costly. We know that it's a significant investment, and so we want to have a plan that really truly serves you. We hope that you'll like Alex, that Alex will help you make a good choice. We hope that you'll like the flexibility of choosing a different combination of plans that's the best fit for your family. We hope you'll like having choices around dental and vision plans, so you can, again, pick the plans that are the best fit for you. And we hope that you'll like having tax advantage money to pay your out-of-pocket expenses, whether that's a health savings account or a HealthFlex or a flexible spending account. We hope you take advantage of those offerings. All right, well, that is all I have for us today. We do have a little bit of extra time. Bob, are there any questions that we should answer out loud or?
Sorry,
Okay.
Kelly, there is one. There were a couple questions about the deductible and how that works. So I thought it'd be beneficial to show that HSA plan slide again for people to be able to see it and for you to talk through how the family deductible applies if more than
Yes.
one person is covered.
That sounds great. And I'm actually going to pull up something a little bit different. I'm going to pull up this plan comparison that I keep directing you to, because then we can actually look at the deductibles in all the plans instead of just the one on my screen. So let's talk about the deductibles for the different plans. So here we have in the plan comparison, annual in-network deductible. Okay, so here are 3 HSA plans in green, and here are 2 HRA plans in blue and our B1000. If you cover one person in the plan, the single deductible, that top bullet point, will always apply. So if you're in the H2000, it's a $2,000 deductible. C2000 is a $2,000 deductible. Actually, the single deductible always matches the number in the plan. There's a little tip for you. So that's just if you cover one person. Now, if you cover 2 or more people, in these 2 plans right here, the H2000 and the H2500, see how it says no individual deductible if more than one person is covered. So for those 2 plans, if you cover 2 or more people, that first bullet never applies. You always have to meet this higher family deductible. Now, remember, usually it's not just one person working toward that, right? You've got 2 people, you've got 4 people covered in the plan, and they're all working toward that. But it always applies. And those are the only 2 plans where that's the case. In all 4 of these other plans, if you cover 2 or more people and only one person has expenses, the top bullet applies, the individual deductible, and it's only if 2 or more people are accumulating expenses that you look at the second bullet. And this is really just to keep these plans in compliance with IRS rules around high deductible plans. There are minimum deductible requirements, and in order to keep these plans compliant, that is what we needed to do. So this is the key in the design is it says that for these two plans, there's no individual deductible. So that first bullet is gone if you cover more than one person in the plan. So if more than one person is covered in those two plans, you always meet the family deductible. And since we're talking about deductibles in the HSA plans, the deductible includes medical, pharmacy, and behavioral health. In the HSA or the HRA plans in the B1000, it does not include pharmacy. So you do not have to meet the deductible before the plan kicks in for pharmacy benefits. I hope that was helpful. Anything else, Bob, that you think we should review?
So the only other thing is it sounds like the QR code wasn't working well. But maybe the link is, if you could go back to a page that has that, I have struggled to get the link out to people. It doesn't seem like it was
Is
working
it
in the Q&A. So I
okay?
think it's
Is
for
it
the plan comparison one, Kelly.
okay? So this is it. I'll try to paste it in, although I'm sure you've already done that. So yes, I will go back to the QR code.
If you could
Find
paste it in the chat, I cannot add to the chat, but I can add to the Q&A. So maybe if you can add to the chat to everyone, they'll be able to see it
Okay,
better.
I'll try that.
And then as of right now, I do not see any open questions in the Q&A. So if anyone has questions, please feel free to ask.
There we go. And this is so this is the QR code, but also here's the link right here. So if the QR code isn't working for you, you can type in this link. And I'll try to do it in the Q&A as well. Oh, good. Hooray. All right. Well, you all have spent 90 minutes with us, and we are grateful for your time, whether you are doing that live today or whether you come back and listen on a recording. We are grateful for the amount of time that you are choosing to spend thinking about your benefits. We feel like health benefits are a really important benefit, and we know that they're not a low-cost benefit. So please know that, at Wespath, we work really hard to create a set of benefits in the health plan that really serve you in a variety of ways, depending on what your individual needs are. So we hope that you learned something and that you feel confident going into annual enrollment this year and picking the best possible plan for yourself and your family in 2025. Thank you.